Hello and good evening, really, to FBL Broadcasting and our coronavirus update. I nearly got that wrong last time. We have MP Greg Smith with us today. Thank you very much for your time, Greg. Can you hear us?
Good evening. Hi.
Good. That's all good as long as everything's working. First day back, isn't it, really? Or a couple of days back to the Commons?
Yeah, the House went back yesterday, where basically all they did was pass the motion that allowed the House to sit virtually. And today we saw the first 2 question times and a statement made in this hybrid House of Commons, which is first time in 700 years the way the House of Commons has changed the way it's done its business, where there can be up to 50 MPs physically in the chamber maintaining social distancing, and then up to 120 can be on Zoom participating virtually. Although the system in order to participate is the same as any other question time, where you submit questions or submit your desire to ask a question in advance, and then there's a shuffle that one of the clerk's offices does, and it produces an order paper of a list of questions. And sadly, I didn't get through the shuffle for either Welsh questions or Prime Minister's question time today, or indeed, because of the virtual nature of participation now, normally after a statement is when you see us all bobbing up and down on the benches trying to catch the speaker's eye. Clearly that can't happen on Zoom. It would look very weird if it did. And so there's that same shuffle process to try and randomly pick as many MPs as want to ask a point after a statement to do so, and I didn't get through that either. I am through a shuffle next week for local government questions, and we'll see. They haven't done the shuffle yet for the other ones, like next week's Prime Minister's questions and so on.
So just again, the shuffle is what? Is that who gets to go on?
So we submit the desire to ask a question or make a point after a statement in advance, right. And then because clearly you couldn't have all 650 MPs asking a question in a single question time or after a statement, right. There is a randomised process that comes up with a list of MPs that will participate in any one session. Right. Now normally in normal times where we'd all be in the chamber, we could freely go into the chamber, that's when you see us, it looks quite ridiculous, but you see us all bobbing up and down trying to catch the speaker's eye. Essentially that element of Parliament has had to be taken away and formalised more into this process. Okay. So you can't just come up and catch the speaker's eye and say something that you never expected to say 20 minutes before anymore. It is a little bit more structured than it used to be in the way of who says what and when.
So the speaker will decide who gets to speak, is that correct?
No. Ultimately, of course the speaker does, he calls you, yeah. But so there was a statement by Matt Hancock on coronavirus this afternoon. Yesterday, the House of Commons authorities invited MPs to submit whether they wish to participate in that statement, and then the same process that determines the order paper, that the list of questioners that you'll see before every Prime Minister's questions or whatever, that same process comes up with a number of MPs who will be called on Zoom in the virtual Parliament to be able to address Parliament, because clearly the randomness of being there and bobbing up and down simply can't happen on video screens, because you just couldn't get. Zoom has a maximum of 120 participants, right. And even so, you couldn't see the speaker couldn't see all 120 screens simultaneously. Yeah. So we wouldn't know who is bobbing up and down in their home office or on their sofa or whatever it might be.
Yeah, but push Zoom to the side for a second here. When you're in the Commons, if he doesn't like you, or she doesn't like you, shall I say, as well, could you never get a chance to speak? The only one standing up or bobbing?
I suppose that could happen, but I mean, look, I've only been an MP for a few months of 70 years of age to stay at home, so we're still well within that period. What Matt Hancock has said in the last 24 hours is that we are in the peak. So hopefully, and I don't know whether this will...
Who was it? There's another agency or something. They were saying about the amount of deaths could be more.
Yeah.
Was it the ONS or something? They were saying.
Yeah, ONS, yeah.
Yeah, they didn't compare it against last year. So, but here's an interesting.
Well, since well, it's really horrible to talk about it in these terms, but there have been some weeks. I believe it's the information I got on this one is that, like a lot of things in government, the language that is used around certain things isn't necessarily always as obvious or as common sense as it could be. And this is the HCID definition is a very, very technical medical one. And the reason, as I've been briefed, is that statistically, because of the relatively low mortality rate from COVID-19 compared to other...
Okay. I was going to say 18,100 people is...
But
one in
statistically...
5 they were saying, wouldn't they? So,
wait, no, it's not as high as that.
No, but that's what they're kind of saying it would be. Or infected by it, 1 in 5. That's what they're saying at the start.
Yeah, it hasn't panned out to be anything like that. We're more in the 1-2% marker. Now, as I said a minute ago, every single one of those lives lost is tragic. Unfortunately, the way the language and the technical definitions of these things work, that is why on this website it is classed as something else. I think the important thing to do here is not to get too hung up around these technical definitions and get on with the job of supporting the NHS, getting them everything they need to fight this. You know, we have got capacity in every part of the United Kingdom within the NHS to take patients in. Anyone that needs a ventilator, there is a ventilator there for them. And likewise, getting on with the Herculean effort of getting things like the PPE out. 1 billion items of PPE have been delivered so far. Is that enough? Well, of course, you've got to keep going. I was talking to the chief executive of my local healthcare trust, the Buckinghamshire Healthcare Trust, earlier, and actually the rate at which hospitals go through PPE is in the thousands a day. And so the ability to keep the hospitals stocked is always going to be one of replenishing stock on a very frequent basis. Rather than individual hospitals carrying months worth at any one time, because of the sheer volume of PPE, of gowns, of gloves, of masks, of visors that anyone that needs them in a clinical environment gets through. And that's why the army has been brought in to manage that logistics exercise. And I think that's where we've got to focus our effort rather than on some of these cumbersome definitions.
It is, but when people look at that and say, it's not a high infection, it's a bit like, well, yeah, I mean, I understand what you're saying, but yeah, well, hopefully that'll explain to a few people out there. I mean, it does say, infection prevention and control, so it's kind of along the same lines. It's a bit like, we notice there's something out there, but HCID clearly points out, this is highly contagious, and we need to do everything we can to limit where infection prevention is a bit...
Yeah, as I say, the language in so many parts of the public sector can often be very, very cumbersome. And, of course, we all know coronavirus is highly contagious. That's why we're all staying at home. Within this particular definition, though, it doesn't meet that certain criteria. No, yeah, it's not saying it's not highly contagious. It's saying it doesn't meet that very technical definition
of a high mortality. So right, okay,
yeah,
okay, I'm happy with that. I thought that's what you'd come back with personally. It's just it's nice to hear it from somebody who has the necessary context to give us the right information. Now, the second point, next question is published on the 19th of March on the government website, hospital discharge service requirement states that hospitals need to discharge all patients, that's 99%, except for pathway 3 patients, which is 1%. Did you get the figures on this?
So the figures aren't actually available on this, because obviously they are hospital by hospital. I did ask the Buckinghamshire Healthcare Trust for it, but the level of work that would have to be done to get those exact figures actually would put a burden on them that I wasn't prepared to put on them at a time when they're having to focus on caring for the people that need their care right now. So what I have determined from everything I've looked at on this issue is that we're in a twofold situation. There was clinical advice from the very top of the government's chief medical officer that hospitals should have to do this for the safety of everyone. However, that is not to say that people who need urgent hospital care shouldn't also be in hospital. And I know that our local hospitals have done an enormous amount of work to ensure that there is segregation between the wards where there are COVID-19 patients and the wards where there are not, to keep people as safe as they possibly can be. Across the whole country, there are some 33,000 additional bed spaces within the NHS to cope with both COVID-19 and those needing urgent care within the National Health Service. And actually, it's gone a little bit the other way, in that something I'm quite concerned about at the moment is that there are people out there that do need to go to A&E or do need to present to their doctor or to hospital with conditions that could be very, very serious, that are not doing so because they believe the NHS to essentially be shut to everyone other than COVID-19 patients. That is not the case. And we very much need people that are genuinely seriously worried about their health, that think there may be something seriously wrong, that can't be solved with a call to 111 or seeing their pharmacist. There's something that's seriously wrong. The hospitals are still open for you too, and it's something that can't be stressed enough. That of course A&E admissions are radically down, but if you think there is something seriously wrong, go to hospital. You will be treated, you will be cared for, and our hospitals have done an enormous amount of work to ensure that if you do not have COVID-19 symptoms, you will not be mixed with those that do.
I've had a few people say to me they've working in a social care sort of setting, they've tried to submit people to hospital, and they've said, no, you can't. And they've said to me, I can't, they won't take something, they're not bad enough or whatever. And I've said, well, that's probably got to do with the hospital discharge requirement. So
it will be a clinical. It will be a clinical decision. What I would say to any residential care home or any social worker in Buckinghamshire, or indeed anywhere else, if you're in my constituency, get on to me. If you get on to your MP, if you believe someone who seriously needs urgent care within a hospital environment is being turned away, get on to us, and we will get on to the healthcare trusts and do our best to sort it out. I've already done that for a number of people.
Okay, the people I've spoke to, they don't want to have their name out there. They want to stay.
No. This would be entirely private. People that come to their MP for help, certainly people that come to me for help, I don't, go and broadcast it. It is totally confidential, totally private. And as long as that individual consents to me contacting either the NHS or the government or the council on their behalf, I will go into bat for them and get the result, or do my absolute best to get the result they need.
Okay. I know you would do that. You seem that sort of nice guy that you would, actually. But I do feel that if you did obviously say patient M needs to go there, they'll say, oh, well, I know who that will be then. And then they could...
at the end of the day, it is clinically led. So I, as a politician, can, in total confidence, go to the NHS or the council or any government department and ensure that the confidentiality of my constituent is maintained at all times, just as it would be from clinician to clinician or lawyer to lawyer or whatever it might be, to ensure that I can do my best to make the case for why that person should get the care. At the end of the day, it will be a clinical decision. I'm not a doctor. I have no medical background. But I will do my best to make sure that person's voice is heard.
That'll be good, thank you. I am a bit worried. I know you're saying you don't want to tie up their time because they're doing other things, and retrieving data can actually be exhaustive. The biggest problem I have, or what I can see from all of this, is with the max exodus, depending on how many people it was, do you think with this knee-jerk reaction that actually they were pushing COVID patients into social care, into like care homes and stuff like that? Because I find...
I've not seen any evidence of that. Of course, actually in Buckinghamshire we've got Olympic Lodge next to Stoke Mandeville Hospital, which actually is more of a receiving centre, if you like. So actually for some patients leaving the hospital setting who maybe aren't ready to go straight into a standard normal residential care home, Olympic Lodge is a facility that is quite unique to Buckinghamshire. That we have. That's got 240 beds in it, I think. So that can actually take a significant number of people, particularly from Mandeville. And the council and the healthcare trust are working absolutely hand in glove together to ensure that if there is more capacity needed, they will work together to find that.
Yeah, but the question is in the early stages back in March, when they released this discharge requirement, did people, for instance, who they didn't know they had COVID because of the knee-jerk reaction, is what I call it, and they sent them straight out without testing, they could have actually got into the homes, the residential homes or other care facilities, and also frontliners who might have been affected.
I get the point you're making. I personally have not seen evidence of that. Certainly, where I have heard of there being COVID outbreaks in care home environments, that's actually been in more recent weeks. So the incubation period of COVID-19 from the point at which these hospital discharges were happening would have already been over for some time. So I'm more than happy to, I certainly can't discount it. I've got no evidence to discount what you're saying, but I have seen no evidence that was the case.
Okay. Again, it's not, unless you look at the figures. I mean, some of the questions that were asked last time was obviously gaining the data. Would we actually see how many people were readmitted? Because obviously within 5 days, if they started to show any signs, it was a bit like, well, actually, they probably didn't get it at the care home. They actually got it. They already had it when they were leaving, and then it came back.
I can't discount that as a theory, but equally, I've got no evidence to suggest that did happen either.
I have no evidence either.
Yeah.
So there we go. On
the ambulance point you made, there has been
yes.
I get a bit of a briefing on that. All ambulance staff have been wearing appropriate PPE from briefings I've been given. Patients have largely been transported individually, therefore haven't been in the position where they could pass it to other patients if they had it, if that makes sense.
It does, but
Now that's a Buckinghamshire specific briefing. Whether other things have happened elsewhere in the United Kingdom, I can't speak to.
So the people that you spoke to basically are saying that they've not asked for 2 patients to be transported at the same time, whether it's NHS or
no,
ambulance.
all social distancing has equally been maintained between anyone in those ambulances. So you've got the 2 metre rule, but as I understand it, patients have been transported on their own.
Yeah, so there hasn't been 2 patients in there, because with obviously the person in the back and the 2 patients, you can't keep a 2 metre rule.
Yeah.
Yeah, so they're saying only one.
So the ambulance staff wearing PPE, the patient not.
They have been wearing PPE. As far as I'm aware, they've been wearing their masks.
No, the ambulance staff have. The ambulance staff have. Yeah. Nothing in anything I've been told suggests the patients have been given PPE.
No, they haven't. They've wore a mask. That's what I've been told.
Yeah. Sometimes patients have worn a mask, but not the full mask, visor, gloves, gown.
I would expect somebody leaving the hospital to be wearing gloves. I'd expect as soon as they come out of the hospital, the gloves will be taken off and disposed of in the black bag. Then new gloves placed. Them taken into the ambulance, and then once they arrive at their location, the gloves will be taken off. Well, the gloves will be taken off, and then they're free to go into the house and obviously wash their hands if so please. As per the document, or one of the other documents that I read, there's loads of documents. They're then given a black bag, which they're supposed to keep for I think 48 hours, and then they can throw it in the bin. Obviously, to not
yes, that is a very important. That's a very important part of the guidance to everyone. Actually,
yes, that is double bag as well.
But actually, I think there's been a good cut through in the marketing around wash your hands, 20 seconds, soap dissolves the virus. There's been good marketing around the 2 metre rule, around understanding how long to go into isolation before it displays symptoms. Actually, something that probably hasn't been as well publicised, but is actually very important, not least to the key workers, refuse collectors every week, of the importance of ensuring if you have had the symptoms of COVID-19, particularly tissues you may have sneezed into or blown your nose into, to double bag them and to keep them in your house. Actually, I think for tissues it's 72 hours before putting them in your outside bin.
Yeah, you might be right there actually. It might be 72 hours. But I don't think it's in your house. I think it's outside, but not in the bin. Because if you keep it in the house, don't put your rubbish out for that. Yeah, don't put it. Yeah, time bin to collect. Yeah.
Yeah.
But I think you're right. I don't think many people know about the double bag rule, and also keep it to the side. But maybe that's something you can push forward. There you go. So we need to raise awareness just so people know.
Absolutely. We're still in awareness raising. You know, I was in Tesco. I did the family shop at 9 o'clock last night in Tesco's, and actually there was still a frightening number of people who didn't seem to be able to follow the 2 metre rule within the store. I didn't say anything. I just bit my lip, but
I will say about that. I've been speaking to Aylesbury Mayor, and we have discussed this. And I said, you know, sometimes you do forget. It's like people going up the wrong way. It's labelled, you know, up and down certain aisles, and you do see people just go, and then they don't even realise they've just gone into, oh, I need that, and gone and grabbed it. So sometimes it's not really that the person's.
No, I'm not saying anyone. I'm not saying that doesn't happen. I think there were 1 or 2 individuals in the store last night who were just
didn't care,
walking around as they normally would.
Yeah. Where I was at the supermarket a few days ago, a guy just walked in. I mean, I use the scanner, but the guy literally walked up to the checkout, and the lady said, "Can you please go to the end of the queue?" And he was like, well, why? You know, well, everybody's lining up, and they're then allowed to come to whatever counter is free. You have to join the line, and then he started having a go, and then she was like, well, those people are waiting, so can you please just go to the back of the line? And he wasn't happy about it.
There really is no excuse for people behaving like that, because at the end of the day, everyone that works in our supermarkets is on the front line as much as anyone else, keeping the shelves stocked so that we can all get the necessities we need to survive, food. And they're all working under very stressful conditions. It's not normal in our supermarkets to see social distancing having to happen, some of the essential items flying off the shelves as quickly as they have been doing. I think the country is on top of toilet roll again, but the flour shelves the flour shelves are still completely empty with all the home baking that's going on. And actually our supermarket staff are operating under very stressful conditions, not normal conditions. And I think we owe it to them to actually show maximum patience and kindness to them, not have a go if we have to wait 10 minutes longer to check out.
Exactly. It's one of those things where you just think, they don't get paid a hell of a lot of money, mate, so just back off. And even if they did, it doesn't matter. People don't care. They'll always be that way, no matter what it is in life. And it's a bit like it does raise your, the back of your neck when when people are having a go at this, because you want to say, look, mate, just do as the lady asks. You've jumped the queue basically. Everybody else seems to be obeying it, and you're not. Just please do that. It's very sad. Going back to the discharge requirement. Yeah, that's fine. It's not a problem. I've got quite a few from people who do actually work in the private sector as well of healthcare, and it says one of them is it acceptable for some private PTS ambulance to be turned away from certain NHS Trust ambulance stations for cleaning procedures after each transfer? Because actually it is documented that they should be cleaned after each transfer.
Yes.
And they have been turned away. There's another thing I'm getting. There seems to be a little bit of a ridge going between private and NHS. And the private people are starting to get a little bit narked about it from what I see. I don't know how or how it's developed, but from what I'm getting and what I'm receiving from people is literally like, no, you're private, you can't have this and you can't have that. Where the private are like, no, we're helping you. We're trying to alleviate some of your, we've been brought in to alleviate the amount of patients that you have, where it's transferring patients or whatever.
Absolutely. Actually, I've been enormously impressed in everything I've seen of the way the private healthcare sector has risen to the challenge to support, essentially become part of the NHS throughout this crisis. And I'm very happy if you want to send me the details of the cleaning station that this is happening at, to follow that up with the ambulance service and with the healthcare trust to see if we can get it resolved.
Okay. It's an interesting thing that, from a point of view working in the NHS, I can understand why there is a ridge, because allowing the private sector to take over where the NHS should have sufficient services to do so. But then again, we are in a crisis, so that's where these private ambulances and other care homes and stuff comes into it.
The private sector is being used extensively throughout this crisis. Essentially, the NHS has bought in all of their services. Now, in parts, there are private hospitals, like the one down in Missenden, that are providing some of the specialist cancer care. Others are playing their part as part of the main COVID response. And it certainly shouldn't be the case that any private sector provider that is doing their bit as part of the response to COVID-19 should be being treated in an unfair manner. So again, if you can send me the details, either anonymised or if with the consent of the person raising it with their details, I will happily take up each and every issue. Or, if they're not from my constituency, ensure that the Member of Parliament that represents them takes that up.
I'll give you a little story, which was... Domino's are given, I think, apparently £100 million worth of pizza to all NHS professionals. And so they deliver it to, obviously, wherever they are in the hospital, to certain departments. And one of the private guys was like, oh, can I have a slice? And they said, no, you're not NHS. And it was like, whoa, that's a little bit... It was a bit like they're transporting, they're doing their thing, Again, they may not be NHS, but they are actually on the front line as well. I mean, that story just made me laugh when they said it. I was a bit like, well, first of all, the person who noticed, obviously, that they're not NHS ambulances or staff, and then obviously to follow up with that, I was a bit like, we're in this together. Surely a slice of pizza wouldn't really matter. So,
No.
But that's what I mean about the ridge. That's what I mean about the ridge. It's a bit like, it shouldn't happen, but it does. And certain things, the private people in care homes and looking after in the social setting and everything, they do feel they're not getting appreciated. They do think when, for instance, the clap for the NHS isn't a clap for them. They feel that they're totally ignored and nothing is for them.
That's actually sad, very sad to hear. Actually, I'm always very clear when I publicise the Thursday night clap that it's the clap for carers. It's not just a clap for the NHS. Of course, the NHS are an incredibly big part of that, but actually, it's all of our carers. It's a clap for everybody on the front line combating this terrible virus, and it is as much about our social workers as our care home staff, public sector or private sector, who are looking after people in this time. It's as much about our police officers and our firefighters and a lot of people who work for our councils who are on the front line. There's the supermarket workers we were talking about a few moments ago, the farmers who are ensuring that food is actually making it into the distribution chain in the first place, the guys and girls that are driving the HGVs to get the supplies around the country, our armed forces who are doing so much on the PPE distribution effort. Actually, who we're actually clapping for, yes, it is a massive part of the NHS, but it's actually everybody that's doing so much as part of the national effort.
So I was about to have a coughing fit then.
That's right.
I said this first time, to thank everyone when I first started doing some of these broadcasts. Thank you to all the key workers, especially people who are, who we might not think about, people working, at the supermarkets as well. What you're all doing is definitely helping, and allowing us to carry on. I mean, I think another thing about people complaining about, I'm stuck inside. It's, why? I want to get out. It's a bit like, well, all you've really got to do. I mean, I'm really busy. I'll tell another little story, and hopefully not bore you. Which was last week, and I'll own up. Last week, I was so sorting things out, getting there. I totally forgot about the time. I usually set some, things up on social media to say, clap for the NHS and key workers. Totally forgot about all that. Totally lost track of time. I literally was like 4 hours out of my life. And then the next thing, but what was really nice about it was I heard the clapping. And I was like, whoa! My brain literally just switched on. I was straight outside, banging whatever I had out there, which is nice as well. It means a lot of noise is going out there. A lot of people clapping. So to me, it's a bad story for me for not actually being switched on enough there, but also a good one because even though I did not so much forget, I got totally lost in time. The amount of noise out there, thanking everybody and their support is amazing. But then it throws it back to all you've got to do is stay inside. That's all anybody's asking you. All these other people who are out there and who have to go to work, totally understand you don't want to be inside, but you're not putting if you go out, you're naturally going to put yourself at risk. And if and all everybody's asking, and if you go outside and you're clapping, then why are you going out walking about? Why are you doing that? I know fair enough for exercise, but if you've just had enough, you just want to get out and about. It does throw it around a little bit, doesn't it? It's a bit like, well, you're contradicting yourself. If you're out there clapping, thank you NHS, and then all of a sudden you're going to go and see your mate around the corner for a barbecue. That clap means nothing.
That's not on, no. That is not on. I mean, of course, the clap is meant to be done on people's doorsteps or from their front windows.
I do it in the back garden because there's more people who can see.
Okay, fair enough.
And also I can make enough noise as well. I mean, there's only about 4 of us. And to be fair, I do think this, especially with the way, obviously, houses are put across. The front door, I mean, as much as it's nice and depending on where you live, could actually put you within that that 2 metre rule. So it's a bit like so it's a bit. And also I've got a lot more things to bang around in the back garden, make a lot more noise as well. So I'll just quickly go through some of these questions then. I'm getting people messaging me in. That's what you might hear all the dingings all about. I got one question just comes straight through. It says, asking why don't ward staff from ambulance control centres of that a patient has had COVID. This leaves PTS crews vulnerable. Oh right, why doesn't the ambulance control centre inform when a patient has had COVID? Sometimes they're not getting told.
I can follow that up. It's my understanding that if someone is being taken to hospital as a result of COVID symptoms, then the ambulance staff should certainly be told that.
Yeah.
Or is the question if someone has already had COVID-19, has been confirmed as having had it, and is now got something else that's worrying?
Yeah, I mean, again, this is one of those keep it quiet scenarios. They're messaging me. They're not obviously putting it up on there, so they're probably hopefully they'll if I open it up. It just says it leaves PTS crews vulnerable. So yeah, I'm sure they'll come back on that, or anything. I can pass that along to you anyway. That question. So also another question: why have certain ambulance trusts not informed private ambulance companies about updates? Now, what this is to do with is I've told them certain things. I said it a little bit earlier. People were going on saying to me about certain things. I said, well, that's to do with the hospital discharge. The service requirement, and they're like, don't know what we talk about, don't know, never even heard of it. So I said it to them. They go, I've never seen this. Things about, I mean, I've trawled through the government sites, looked up certain information, trying to fit everything in, and try and look at it from all sides, points of view, and try and steer people in the right way and pass on the information where required. Because some people have asked questions for you, and I'm like, no, that's this. You need to look at that. That answers that question on paragraph 7 or whatever, page 6. Being like your secretary. But yeah, they're not getting the information. And this also stretches to the private sector. A few of the times I've had to pass on the documents and say, well, it's actually on the government website. It's on the NHS England as well. It is actually there, but it's not flowing through the channels. Certain procedures, certain aftercare requirements. I mean, that's something you can obviously pass on. I don't expect.
Okay, so what I'm hearing here, actually, from a previous question as well, is that ambulances in the private sector that are supporting the NHS at this time are not being treated as equals and are not getting the information that they need, and that is something I will happily take up with Buckinghamshire Healthcare Trust.
Yeah, okay. I'll probably send you some of these questions. Well, I will send you these questions, so at least you know them.
Yep.
I mean, I just want to go through. Do private care homes still need to enforce? Oh, this is care homes. This one. Do private care homes still need to enforce care assistants to stay at the place of work for a minimum of 7 days after a suspected case of COVID-19?
My understanding of the guidance is that you should self-isolate at home if you think you have been exposed or have symptoms of COVID-19, not self-isolate in your place of work. Now, that I accept there is a grey area if you are a live-in carer somewhere.
I think the question is if somebody becomes ill at the care home, they've been told they have to stay working for 7 days. They're not allowing people in or out.
Is that a specific care home or something that you've heard across the sector?
This is a question.
Because my understanding is that if you show any symptoms of COVID-19, the new persistent cough, the high temperature in particular, then you should self-isolate at your home. 7 days if you live alone, 14 days if you're got a partner or kids or whatever it might be.
But if somebody at the care home has it, they're actually saying that they've been told they have to stay for 7 days.
So if a resident of the care home has COVID-19,
yeah,
I will seek to get clarity on that. Clearly it is. What I would hope is that all staff within that care home have got the necessary equipment to protect themselves, so that those within it that do have COVID-19 don't pass it on to them. But that is a very, very difficult situation, and I can understand how scary that must be for the people working within those care home environments.
Yeah, because they've got families, and then they're like, what you mean I can't go home? And I hear this from partners of the people who go to these as well. They're quite worried, obviously, for their other halves. So
of course,
it is a scary thought. But again, we can come back with that next time if that's okay.
Yep.
It says, why can't all ambulance services use uniform guidelines for safe working practices? I don't understand that question. It just came to me. Somebody sent that to me. I need to follow that up, really. I think what they're saying is that nobody seems to have the same guideline on everything, each different area. So I think this must come from an ambulance guy or girl. Seem to have different practices. Why isn't it uniform in all areas?
Ambulance, like hospitals, the ambulance service is not a national service. It is a one that is delivered, yes, through the NHS, but by different trusts, and so the trusts are free to, within limits, set slightly different guidelines to certain practices of the way their staff operate. Certainly when it comes to COVID-19, there is very clear guidance from central government that everybody should be following, and if that's not the case, then if it's in Buckinghamshire, I'd certainly can take that up, and if it's outside of Buckinghamshire, I would urge whoever is concerned to raise that with their own Member of Parliament, or indeed direct to their own healthcare trust, ambulance trust.
Okay. I want to move on to our other questions for other reasons.
Yeah, go for it.
But there's one I really want to... there's actually two here.
Go on.
I will send you a list of these, but because I'm worried about time. I don't like to take up more than an hour of your time, because it's so greatly appreciated that you do this. Would local and regional governments be willing to discuss with care home suppliers, be willing to honour full pay instead of paid statutory sick pay? So if they get COVID, it seems to be they're getting put on SSP, which is, I think, it's unfair.
What I didn't get in that question was your reference to local government, because local government at the moment local government are some of the best payers in the country for the services they're receiving at the moment. So I know Buckinghamshire Council are paying all of their suppliers in full, whether they're delivering a service or not at the moment. So local government is actually a very good payer for services at the moment. I guess there may well be a question within the private sector there, and I guess it depends on whether someone is on a contract or is agency staff, or however their circumstances are engaged to work for that care home. What the government did do, of course, was bring statutory sick pay in for day one if you have symptoms of COVID-19, which certainly wouldn't have been the case prior to this outbreak. I know it is a very, very difficult time for a lot of people, but it's certainly the case that the government is very clear that they will stand by everyone that does the right thing, and if you've got the symptoms of COVID-19, you should absolutely go and self-isolate at home for 7 days if you live on your own, 14 days if you're part of a wider household. And the government has been very clear that it will stand by everybody that does the right thing.
Yeah, and pay them their normal wage, just not SSP. Okay. This is an interesting one. It literally came in. It was the cost of gloves has shot up since the crisis, and private care homes are paying the price. Prices used to be £3.50, but have now shot up to £7. And I checked myself today on Amazon, and I've bought these gloves for the work that I might do on my camper van. That is going to be a roaming studio, by the way, for people to know. I wear them, and I mean, it was like they were like £3.99, £2.99, something like that for 100. Now I can't find anything less than £10.
Yeah, there has been profiteering. There has definitely been profiteering.
That's Amazon.
There's definitely been profiteering. I'm not going to endorse that level of profiteering. Although I've fallen victim to it as well. If I can find it in my desk here, this tiny little bottle of hand sanitizer I bought the other day. I suppose it would normally be about 50p in good times. That cost me £3, and it's what 60 mils. But I wanted it, so I got it. I don't endorse in any way profiteering in this. When it comes to PPE provision, of course, the government have now put in place. It's been in place a couple of weeks now. That's involving the armed forces. That's involving the LRFs, the local resilience forums across the country, being able to source PPE very much on a just-in-time basis at the moment, but to keep people stocked up, which includes the private care home sector. So they should be able to source their PPE through the government scheme rather than relying on
I did ask
other sources.
Aren't they trying to source it through, for instance, government-led operatives? And they said they're not in charge of purchases, but they usually buy them from Amazon. So, I mean, I will feed that back.
But they are classed as on the front line and will be able to go through the government scheme to get the national logistic operation that the armed forces are involved in, to get PPE through that means. There are also, not necessarily on glove manufacture, but there are lots of local businesses who are supplying PPE. I know a lot of our gin distilleries locally have turned their hand to producing hand sanitizer. Honest, I know that's one brand that I've seen doing that. And actually, you and I have spoken in the past about how we're both big Formula One fans.
Oh, yes.
Mercedes AMG. Well, absolutely, that was tragic. But Mercedes AMG F1 up in Brackley delivered 700 visors to Buckinghamshire Healthcare Trust today. Wow. So other businesses as well are producing elements of PPE into these settings, and so I would urge everyone's got to do everything they can to get the stocks they need, but they are entitled to the government scheme, and I would urge them also to reach out to those local businesses that, be it through 3D printing or their own expertises, are producing PPE equipment for the front line.
All right. Again, yeah, it's good. It's good that you mentioned that about all the other people who are trying to help. I mean, there has been, I have noticed on obviously the news today, people saying that the government hasn't been able to utilise some of the stocks that people do have, which is a shame. And they've said that the organisation has been pretty poor in their sort of idea, and then the government's come back with other things saying, sometimes they're not credible people. They've only just set up in the last 2 weeks to try and make their money out of this. But there is a lot of companies out there who.
I think there's two things to say here. Number one, the government have arranged for the delivery of over 1 billion pieces of PPE over the course of this outbreak. Of course, everyone can always say, well, there needs to be more, there needs to be more. Of course there needs to be more. And the government is absolutely working as fast as it can to get every reliable, credible source of PPE into the logistics chain to get it out to the front line. Will there have been some businesses that couldn't produce to the specification required? Probably. Are there some businesses that have offered but haven't quite had orders made yet? Clearly. because people are saying that has happened. And I would say that anyone that can produce PPE to the required standard, keep at it. If the government hasn't got back to you yet, or get onto your MP and we can work out why the logistics haven't added up yet, and make sure that that company can play its full part in this crisis.
Okay, good to hear. Right, okay, now something I want to move on to, because it's,
yeah,
I don't know, it's just me.
Go on.
The communication between health and social care during the COVID-19 outbreak, NHSX is speeding up the rollout of NHS Mail and temporarily waiving the completion of Data Security Protection Toolkit to allow for quicker onboarding. This in line with information governance guidance for COVID-19. So does this mean that patient data may be unsafe and may be accessed illegally?
I would hope not.
I would think so. Working within the NHS sector of the technology area, again, it's not something I want to bring up, but if anybody they used to call me the Gordon Ramsay of IT, where I used to go. Data is a big thing for me. I really have a thing, and it goes back to when we're going to talk about vaccines a little bit later. Data can be forgotten about very quickly and very easily. And I mean, might as well talk about it now. It doesn't matter. It's a little bit later on. For instance, people have said, using the app, they've released the source code for the app, which means, and it's not always the government using it to spy on us. It's actually the illegals out there who will use it to gain access to your information and, for instance, find out when you are, where you are, and what you do.
Yes.
And use it for the bad thing. I mean, releasing source code is a bit like, okay, I'll tell you what, I'll tell you where I hide my key for the front door, but don't use it.
I understand the point you're saying. Now, I mean, what I do know is that certain elements of GDPR have been relaxed during this crisis, and that has largely been around to enable, for example, local government and the NHS to share a little bit more information more freely between themselves than they otherwise would do, in order and GP surgeries, in order to, for example, identify the most vulnerable, that 1.5 million people, so that you can get the food parcels to them, get them the help they need to get shopping in, etc. There is certainly nothing I have seen to indicate that the government would in any way, shape or form sanction a risk to confidential patient data.
I beg different. And I've worked in the NHS. I mean, that's something maybe that you can look into. I didn't expect you to have an answer, to be fair.
Send me the details and I will put that to the Department of Health.
Please do. Again, I'm a right sucker when it comes to looking after people's data. I had a few arguments with Fujitsu Siemens in the CRS project, and they called me a few nasty names as well because I protected data. But anyway, this is big for me now, this one. Distributed Bio, featured in the hit series, are working on Centivax. I know we've got a vaccine, or we're working on a vaccine from Oxford. It's basically working with therapeutic monoclonal antibodies that maybe and could probably neutralise COVID-19 within 20 minutes. So we've got a vaccine, or they're working on the vaccine, they're doing the trials.
Well, so human trials on the vaccine start next Thursday, I think it is.
I thought they started tomorrow. Okay, you might be right. Next Thursday.
Tomorrow. Yes, tomorrow.
I think tomorrow, and within, I think, but if they haven't basically had a really severe reaction to it, I think 6 people are going to get it Saturday, and then it's just going to expand out. And they're looking for volunteers, by the way, in the Thames Valley area. So if you want to volunteer yourself, then off you go. You know where to go. You know where to look.
Absolutely, and anyone that is willing to do that, the nation will forever be grateful for you putting yourselves forward. So the trials are starting on that vaccine. I don't know whether it is the distributed bio product.
It's not distributed bio.
I know the government is very focused in terms of what they've said this week around the vaccine. The trials are starting on now. From the digging I've done, I still can't give you a definitive answer over whether Distributed Bio are engaged with the UK government on this or not. And it doesn't surprise me, because actually often within anything any government does, commercial relationships aren't disclosed until you've got to the point where you have actually got something to announce.
Yeah. I did actually think yesterday they were going to say something. So I was a bit like, oh.
Yeah. So if what Distributed Bio say they can do, I'm sure not just the British government, but probably governments all around the globe are talking to them. What I can't do is give any categoric assurance.
I don't think they are, because Distributed Bio is not part of a major pharmaceutical outfit. It's a gentleman with obviously other scientists clubbed together and created Distributed Bio. And then, I mean, he has been approached with funding from people with capital for their portion of the business, and he hasn't taken the venture capitalists on because he doesn't agree with it, because they want to push up the price. I mean, his idea of his so-called vaccine is $100, where if you buy your vaccine from a commercial or pharmaceutical business, it's going to be about $600 to $800. So he's looking at, or actually the company as a whole, to be fair, the way they look at it is making vaccines available for everyone. Now, because they work on an antibody, okay, what that is that it will only last 8 to 10 weeks. But what that will do is I mean, they're looking to cover the whole range of the influenza, whether it's swine, Ebola, normal influenza, and COVID. That's what they're looking at. Now, where we're looking at a vaccine, I mean, even when you take this, I mean, they told it today, I'm quite surprised they said it. When you do a vaccine, you've basically got to stay out of harm's way for 8 weeks, else you're going to have like double the dose of whatever you've been trying to be vaccinated about. You won't not clear for about 8 weeks. But with an antibody, the way that they do it, the therapeutic way of doing it is, I wish he was on so we could ask him. He'll be able to explain it really easy. What that does is within 20 minutes it will start to work against the actual virus itself, and obviously you'll start to be alleviated of symptoms. So where you can use this is actually, doctors, hospitals can have this. I'm calling it a vaccine. They don't call it a vaccine, but let's just say this vaccine. They will have that, so that as soon as I could come in and say I'm not feeling too good. I feel run down. Got a bit of a cough. You do your little antibody test. Yes, you've got COVID. At the moment I think it's an IV they use. It's not actually a jab, but they'll put it in, and then within 20 minutes it'll start to obviously alleviate your symptoms and hopefully start fighting the virus. To me, that's a far better way of dealing with a virus than pumping somebody with a vaccine every year on year. Because I mean, that's why everybody gets pumped every year for the flu or influenza.
The flu,
is because the strand keeps on changing. Now, what they're hoping at Distributed Bio is that once they've got the gene pool sorted, I mean, again, I'm no scientist, and what I have read and watched and tried to understand with my limited knowledge is hopefully with the vaccine they'll come out, we'll be able to deal with mutations in influenza, where let's say COVID-20 come out, COVID-20 come out, it would actually realise, that's influenza, that's a form of it, my antibodies are going to take you down. Now, all he's looking for, or they're looking for, is funding, is help, is contributions. I think they've received 873,000 in donations so far, or 873 people have done the donation. It's, to me, what he's trying to spearhead is something amazing. And I find it, I mean, the Gates Foundation have actually given him a grant to help him along the way, which is really cool. And Distributed Bio are like 2 years ahead of everybody else in this technology and what they're trying to do. And hence why I'm trying to, point the British government to say, hey, help this team of, scientists out in what they're doing. And hopefully, we can be first on the doorstep to receive probably a discounted price, because we put into the fund That's what I'm going
I think what I know is that everything the British government is doing at the moment is science-led. This isn't the politicians sitting around a table and thinking, what should we do next? It is absolutely led by the Chief Medical Officer and the Chief Scientific Advisor and their respective deputies who we see every day on the press conferences from Downing Street. I will certainly ask the question again about distributed bio, but the confidence that I have, and I know the government has, in those medics and scientists that are advising the government is that if it is credible, I'm certain that they will look at it.
Yeah. Is it credible? Interesting word. What they're doing is incredible.
Everything you've said, don't get me wrong. Don't get me wrong. Everything you have said, sounds, it is music to my ears. It sounds wonderful. It sounds marvellous. It's got to go through that level of scientific and medical rigour, which I'm sure they have. I'm not disputing that they don't have it. By the scientists and the medics that are advising the government to determine whether it's the right way to go for the United Kingdom.
Yeah. Well, I mean, it'd be interesting if you could find out whether the medics, our experts, recommend vaccine or, for instance, this other way of doing things where, it works in 20 minutes. I mean, to me, I think that's financially better for the country to have a stock of, for instance, vaccine that literally only when people become ill do they need to use it.
Yeah.
Rather than trying to millions of people.
I get that point entirely. But it equally would not be consistent for the way that the government has approached this crisis thus far, for them not to take our own Chief Medical Officer's advice on this. Yeah. And so I think that the decision does have to rest with the advice Chris Whitty gives and the Chief Scientific Advisor gives to the Prime Minister, to the First Secretary of State and the Health Secretary.
It'll be interesting to know if Chris Whitty actually knows of distributed bio, and also if he was educated into, if he didn't know about them, who they were, and then maybe, for me, a bit of like a sideline. Can we give them 4 million? If that's enough, just say, look, okay, you can carry on with your studies. We'll use you as a backup. There you go. And because the vaccine, we're looking at least 8 weeks before they can distribute it to the public, because obviously, I mean, that's when the first person who gets inoculated before their resistance is up. I would say 8 weeks. I might be wrong, Chief Medical Officer or whatever.
I don't know.
No, but I presume 6 to 8 weeks. So really, letting them, giving them a chunk of change compared to how much 25 million that's been given away or whatever billion, just to say, look, okay, we're going to help you do what you're doing because we believe in it, and while we still carry on with our vaccine. I just think it's a great way. And then obviously if they come through with it and it works out well, then actually the side, whoever says anything to Boris, or Prime Minister, they can actually say, well, actually we've got 2 options, choose one. Maybe. Okay, I've kept you on for a long time, I'm sorry. Also with vaccines, how are we going to make sure, I mean, this comes down to after lockdown, a lot of people said, I mean, for instance, the phone tracking people, that's what they're saying. So are we going to need first of all, you're going to have a smartphone. Now, how many... You're talking
about contact tracing?
Yeah. So how are we going to make sure, let's say people over a certain age don't like tech, and so we're going to ask them to, I mean, they're not even going to have probably a smartphone. So how are they going to be part of this, or are we just literally, it's only going to be people who have a smartphone?
We need to wait. Yes, clearly apps are going to play a huge part in contact tracing for those that have them, but of course no plan can be entirely reliant on everyone having a smartphone, or indeed a smartphone that the app will effectively work on. So we haven't seen the NHS's proposal on contact tracing yet,
Right.
although we've started to see apps come out and so on. And I think, I would certainly be someone that would stand up and say, there'll be huge chunks of the population, diminishing. Actually, lots of people you wouldn't expect to be very tech savvy these days actually are very tech savvy. Even my 77-year-old father-in-law, who has driven tractors all of his life, got an iPhone for the first time last year, and certainly knows how to use it. So actually, don't discount certain age brackets as not being tech savvy. But I would be the first to stand up and say we need something that isn't 100% reliant on smartphone apps, because quite clearly not everybody has them.
Okay, and it's not going to be RFID.
Sorry?
RFID. People are basically, you're not going to chip up the human race to say, right,
No.
scan us.
No.
Do you want to say no one more time, please?
No.
Yeah, I mean, it did come up. People did say to me, "We're going to be RFID, mate.
Yeah.
That's what it's going to be." I'm like, look, I doubt that very much. Obviously, I think you might be looking at your conspiracy theories for that one, but
Yeah.
is it? And neither are we going to be tattooed either. I don't think that is.
No.
Exactly.
No.
Good. Glad to hear it. So everybody, rest assured. I did ask the question. Greg so gracefully gave me the answer I thought he would give. Also brings me on, moving on to some other conspiracy theories. 5G
let me
cell
guess,
towers.
5G.
Now, there's a lot going in on this. There's a lot of people who've said a few things about it, and
Right.
I mean, for me, coming from a tech background, I do have an issue. But the point is, there's quite a lot out there. But I mean, don't get me wrong. I want super fast broadband when I'm using my phone. I understand why it's all out there. But there is this issue, and what I can see is with this 5G. I mean, from every 2 to 8 houses, there's going to have to be some kind of transponder. There's going to have to be some kind of responder on there, or transponder, which literally is going to be full of. I mean, think of 4G when that was going, and they started to hide it in certain. Remember with the false trees and everything. We're now going to have this with 5G. do you remember that, the 4Gs?
Yeah, a little bit.
Yeah, people were really worried back then, and I mean, we did talk about Wi-Fi back in the 90s last time. Now with 5G, I mean, they're saying that insect populations are going to be affected by this. Scientists are calling out. I think it's in 41 countries, 147 scientists. My main question: has the government done an independent survey into the effects of 5G?
So, everything I found on this is that 5G has passed, or that the equipment that is being installed in the UK at the moment for 5G is all compliant with the various regulations on radio waves and the technologies it uses. So it is all compliant with the rules and regulations that surround these things, which of course actually probably most of them still come from Europe, because whilst we're in the transition period, we are still beholden to the rules and regulations that come from the European Union, which actually on these sort of things are normally quite strict. So from that perspective, the answer is, do they meet every standard that the UK and the European Union has set? Yes, they do. If you're asking for any more in-depth studies, there is always scope to do more study, more examination on any new technology.
But there hasn't been one then, basically. So they just tick the box there. I don't know. This certified, that fine.
Well, again, but you've got to remember a lot of these standards that are set by national governments or supranational governments in the case of the European Union. Again, they're not a bunch of politicians sat around a desk saying, what should we make the regulation on this be? Yes, politicians make the ultimate legislation, but it is all scientifically led, and so from everything I have seen, 5G meets the standards that governments all over the globe have set for it, including our own.
Okay, but in a square... again, the standards could be passed for instance, one transponder being in one location against certain distance apart. I mean, how far apart... I mean, this is what I'm saying about, has an independent study been done? Have they put somebody in front of one of these transponders, or a group of, for instance, a cell load of, let's say, a block, and seen the effects and tested that, which I don't think they have. I mean, for the stuff that's on there, I mean, there's 2s and 4s against this, but it's about changing people's DNA and causing headaches and doing lots of things. It is a bit of a scary one.
Well, I've seen no evidence of DNA being changed. Yes, we had
level.
We had at the very start of the early. I think we talked about this last week. The early Wi-Fi networks and so on, people getting headaches and so on, which doesn't happen anymore. And of course, you've got to remember that 5G is live in the UK right now. This isn't something that's going to happen. It has happened. And just because Apple haven't produced a device that works on 5G yet doesn't mean some of the other manufacturers. I think Samsung have got 5G devices out there. I think Samsung do. And I keep seeing the various networks advertising 5G plans and so on now. Certainly the big networks have all got 5G. For those parts of the country that have 5G infrastructure, so it has happened. It has passed the various tests it needs to pass to be allowed onto the UK cellular grid.
Okay. We'll keep this question open.
Okay.
Moving on to more of a financial one in one respect.
Yeah.
Due to the lockdown, people are not using their cars hardly like before. Does the government intend to stop road tax until after the lockdown has finished? And this really comes from people with old cars. People who don't have much money, they are not paying the £30 or maybe £50 road tax for the year. They're paying I think it's £165 every 6 months. They can't afford a brand new car that will bring down their emissions. They're just running their car, and especially at this time, road tax is literally 165 quid they now have to find that they don't have, and they need their car to actually go and get food, to actually.
Yep.
So, is this something the government is going to look into? Because they've already got rid of.
So there've already been a number of measures for private car owners. So anyone that needs an MOT has had an automatic 6 months put on to their MOT. Although that does not mean you can drive a car that is not roadworthy. You are still responsible. You are still responsible.
Windscreen wipers work. Yeah. Water bottles filled up.
Absolutely. Well, I've spoken to 2 independent garages in my constituency, one in Wadston, one over in Westcott, in the last couple of weeks, both of whom have given me cases of people bringing their cars in for a minor fault that it's developed. And actually, once they've had them up on the ramps, and there's photos actually on Facebook from both of these garages showing how there's a particular problem with run flat tyres, that if you don't keep a good eye on them, the sidewalls start to compress and split.
Right.
And often that will happen on the side of the tyre you can't see. So actually, there's a good reason for having MOTs and these inspections and so on, that tyres are perishables, they are consumables, and they are very, very dangerous if they run down to this position. Likewise, another garage showed me photos of someone whose brake pads had gone down so far that essentially it was metal on metal rubbing against the disc. Again, a very dangerous position.
It makes a horrible sound too.
Well, it does, but not everyone notices that. But it's a very, very dangerous position to be in. So I really do urge people, if they think there might be something up with their car, to get it sorted. Garages are open and are able to do repairs to vehicles, and they still can do an MOT if you want one. So that is one thing that the government has done.
If you want,
it'll be interesting to see what happens to the price of. It'll be interesting to see what happens to the price of fuel in the next few weeks, given it seems that oil is now essentially free. They can't give it away.
Well, they can.
The price.
I'll have some. Yes.
Yeah, I mean, indeed. The price per barrel at the moment. I said earlier, I went and did the family shop last night. I went at 9 p.m. into Aylesbury, and I think I filled up at 109. The car was nearly empty. I filled up at 109. It's been nearly 130, 135 a litre. I'll make a small confession, diesel.
That's another thing, but that's for another time.
Yeah, the price of fuel is already coming down significantly. Will the government move on road tax? Well, there is a case for the road fund duty to be looked at. I think if this lockdown goes on beyond the reasonable period we're expecting it to.
Okay.
There's no case for it at the moment, I don't know.
I don't know if anybody's made a point. I don't know how many people are affected by that, but road tax for the people who do, and chances are, unless you've got yourself if you've got yourself a vintage, you don't even have to pay road tax anyway. But
a classic car, no. But there's a lot of people who are trapped with cars maybe 10 years old that now have to pay 560 quid a year.
165. You might be right. Yeah, sorry.
No, it's more than that. It's a sliding scale now. Road tax isn't what it used to be. I think a lot of people are trapped in cars that essentially governments in the noughties told them that they were going to save the planet if they bought these particular diesel cars, which of course has turned out to be not true. They are fairly polluting, but of course, not that many people can just say, "Oh, okay, then I'll go and buy a new car tomorrow." Cars are a lot of money, and people are trapped in those road tax bans on those particular age of particularly diesel vehicles.
Yeah, I mean, to me, I've never had a diesel really, but yeah, I do. I mean, going back to the sort of like the diesel back in the day, it was really supposed to be about biodiesel, wasn't it? But then they didn't work out that using all the rapeseed would actually cause problems for like wheat and all that and everything because of the fields. And what they actually thought was going to happen actually didn't, because it was like, well, actually the price of wheat's now gone up because of what you're planning on doing with biodiesel. So and also obviously once they've done a few more tests and everything, they found out actually it's not as good for the environment as they said. So yeah. I've got people message me in, but that's still going back to the question of question one, and I think we covered enough to do with the healthcare system, and hopefully at some point. I mean, I've taken you for an hour and a half, and I do apologise, but I thank you so much for your time. I'm pretty much not going to ask any more of those other questions. And is there anything else you'd like to add to today's broadcast?
Look, I think, much as I did last week, the most important thing to say is a massive thank you to everyone on the front line, be it the NHS, be it council staff, care workers, social care workers, teachers. Teachers are an important group of people who probably aren't being thanked enough at the moment. Those of them that are working at the moment, we've got 183 schools across Buckinghamshire still open for key worker children throughout this crisis. 160 of them were open through the Easter holidays. So a massive thank you to them as well. Everybody that is working so hard to combat this virus, and to everybody out there at home as well. It's not easy. It is really, really tough to be asked to stay home for weeks on end and to only go out for essential groceries, medicines, to help someone in need. And so I really want to say thank you to everyone for sticking with it. and assure people that all the evidence is that lockdown is working, that we are not seeing the sort of spikes we would see if we all had our usual freedoms, and we will see the other side of this. Life will get back to normal at some point, but for the time being, thank you to everyone for making the sacrifices that they're making, that we're all making.
Well done, thank you very much. Once again, hopefully we can catch up again next week, and I hope everything goes right in Parliament, and you finally don't have to. Finally get noticed. You catch the eye a bit.
I spoke lots before. I spoke lots before recess. I don't have a problem getting noticed. I just haven't got through any shuffles the last couple of days. I've worked from home today and Tuesday. I intend to work from home for the foreseeable and join the proceedings in the House of Commons virtually next week, and then we'll see as provisions start to be announced for the way voting will actually work. There was talk today of a system that none of us have really seen yet, of electronic voting rather than having to go through division lobbies, as to when I actually physically need to go into the Palace of Westminster again.
Okay.
So long as I can do everything and represent my constituents from this room that you can see me in now, then I'm doing my bit by not making an unnecessary journey into Westminster.
For 20 years, I've always banged on. I do not understand why companies act or work in a certain way, except for Big Brother watching you, so to speak. Companies can allow people to work from home. This has proven that. And I hope after this is over, more people will be allowed to work from home so they can spend more time with their family. Maybe after about a year, they kind of, I think they might have had enough time with this lockdown with their family. No, I'm going to go to work for a year. Yeah, I've got to do overtime. But I do hope that does. I mean, as a single dad, I made a decision, for instance, to run my own business and jump out of, my kids needed me. So I made a decision not to be part of going into London working, and because you don't really see your children that much, really. Yeah, maybe in the morning if they're up, and maybe in the evening if they haven't gone to bed. Yeah, and hopefully your train's not running late or something like that. My eyes have been open to the world. I've seen both sides, working in the city and also working, running my own business, for instance. And I do think people have had their eyes open. They do understand that teachers need to be paid more, and also they've got time to spend with their family. And I think they, it will show a little bit. Children will realise this years later. They will remember. Oh, when you was home, Mum or Dad, for like a whole month or two, and they were like, yeah, I remember that. Yeah, but they will see it as a good time, hopefully, and and I hope businesses do take this as saying, yes, you can be Big Brother, but you don't really need to have people coming in, all the time. Maybe once or twice a week they come in and they actually can work from home. We perfectly trust them. Can you hear my cat crying to go out? Shall I let him out quickly? He will moan otherwise. There we go. But yeah, I do hope companies will take this on and understand that, as much as watching people at a desk, really, they're not children. That they do need to be allowed to get on and work. Work. And I think they work better from home. I used to do a lot of working from home, as in, a laptop and everything, and I got a lot more work done than being in the office, so to speak. And hopefully that.
I tell you what. When we are in normal times, you can go into the Palace of Westminster, go and maybe drop laptop in the office or whatever. Immediately have your first meeting, which rolls into your second, third, fourth meeting. Then there's some drop-in over someone, lobbyist normally talking about an issue or something. Then you go into the chamber for whatever the question time is, and then you've got another 20 meeting. The number of distractions in the Palace of Westminster is enormous. Actually, I think I have been enormously more productive as a Member of Parliament, actually serving my constituents, doing so from my house. However, I also think Parliament works at its best when we are all there together, not least the things you can get done by bumping into a minister in the corridor and making your point and case. And indeed, the cut and thrust of proper debate, I'm not talking about Prime Minister's questions or something like that, which, I know a lot of people get a bit frustrated by the way we shout at each other in that, but the cut and thrust of proper debate around legislation, around some of the themed debates that happen in the Chamber of the House of Commons that don't necessarily end up in a new law, but that do show highlight certain issues that need fixing, works so much better when we are all there in person, where you can intervene on each other. And if someone's making a point where you can make a factual correction or say that they've got it completely wrong in a reasoned way, you can actually further the debate much more than we all can peering in down our own webcams onto a video screen where there cannot be that same level of interactivity. So whilst I am more productive from home, I actually do look forward to the day that, well, we all look forward to the day this crisis is over, but that Parliament can resume in the way that I actually do believe it works its best, when people are there together, able to look each other in the eye and make the points they want to make.
I'd agree with that. I would actually agree with that. But there is other jobs out there that you don't, there are people who work with phone systems.
Sure.
I spoke to my energy supplier, and the lady answered, and I was like, "Are you working from home?" And she was like,
"Yeah."
She was quiet for a second, and she went, "I am. I don't know if I'm supposed to answer that." I said, "No, I thank you that you're still working and you're working from home, and they're giving you the ability to do that." I said, "It's really nice, and hopefully you won't have to spend an hour driving." She goes, "Oh, actually, yeah, I do spend a bit of time driving to and from work." So it's good for the environment. I mean, if you think of how many people actually drive in or catch the tube or whatever, I mean, that's obviously less impact on the environment, but it's that bit like people can, instead of having to be at a desk with a microphone on and doing it. I mean, and there is a fair amount of jobs out there like that. So
yes,
it's good just to allow them that trust and just say, yeah, you can work from home, and also they can probably work sort of split hours as well, and they can work with the peak times more rather than the off-peak times. So obviously they got kids, and they got to take their kids to school and drop them off. It's been like, okay, then you can get off the phone system at 2, come back on at 5 if you don't mind. So I just think businesses could change. They could work around. I mean, I've always said this about using tech to its advantage. I mean, like saying working from home, it has its advantages. It doesn't mean people are lazy. You can soon figure out who is lazy working from home, for instance, and to the people who actually get a lot more done. So it'll be nice to see. Once again, Greg, it's been really appreciated that you give me your time. I mean, I've had you for an hour and 3/4 as well, and I usually like to keep you for an hour. So, yes. Once again, I thank you. I will send off that information to you, and be safe and have a good week.
You too.
Okay,
great man. Take care. Bye.